Fibromyalgia is a chronic rheumatic disease that affects the musculoskeletal system and is characterized by intense and chronic pain that affects the muscles, ligaments, and tendons, as well as other clinical manifestations affecting various organs and systems. Due to the pain and constant sense of oppression that those suffering from this pathology must endure, fibromyalgia is also often referred to as Atlas syndrome, a clear reference to the name of the Titan of Greek mythology, condemned by Zeus to support the entire celestial vault on his shoulders for eternity. Fibromyalgia is a condition that affects a significant percentage of the world's population, generally estimated at around 2–3%, with a higher incidence in women, where it is 7 to 9 times more frequent than in men. Fibromyalgia syndrome can appear at any age, including children and the elderly, but generally manifests itself between the ages of 25 and 55, with important repercussions on work, family life, and social relationships. Pain. One of the first characteristic symptoms of fibromyalgia is the onset of musculoskeletal pain, spread throughout the body or in some specific areas, called tender points. These are a series of specific points on the body that are particularly sensitive to touch in people with fibromyalgia, as they become painful following light pressure. 18 tender points were identified, divided into 9 pairs of symmetrical points on both sides of the body, distributed as follows: 2 on the front of the neck above the clavicle and 2 on the upper chest just below the clavicle, 2 at the base of the skull at the level of the cerebellum, and 4 at the upper part of the back at the level of the trapezius, 2 on the external part of the forearm approximately 2 centimeters below the elbow, 2 in the upper part of the glutes, 2 in the upper part of the hip above the buttocks, and 2 at the knee level. In healthy subjects, palpation of these tender points does not cause pain, while in fibromyalgia patients, they are painful. If at least 11 tender points out of 18 are particularly sensitive to pain when light pressure is applied, this is an important sign for a diagnosis of fibromyalgia, but which still requires a broader and more in-depth evaluation of the symptoms. In fibromyalgia, trigger points can also be identified. That is, extremely painful points, generally located within the muscle, which can be recognized during thorough palpation due to their sensation of viscosity and hardness under the skin. Trigger points resemble the functioning of a gun trigger. As if stimulated, they are able to snap immediately and cause intense pain, thus limiting movement and making it difficult to carry out daily activities. In fibromyalgia, the pain can therefore vary from mild to severe and from acute and short to chronic and long-lasting. At the basis, there appear to be alterations in the pathophysiological mechanisms that regulate pain and in sensory processing by the central nervous system. Chronic fatigue. Another typical symptom of fibromyalgia is asthenia, a clinical condition characterized by a state of general weakness due to reduction or loss of muscle strength. It presents itself with a variable intensity that oscillates from a feeling of slight tiredness to a total exhaustion of strength. Patients suffering from fibromyalgia may experience physical, emotional, and cognitive fatigue, which manifests itself, for example, in a lack of energy or motivation, or in difficulty thinking or concentrating. Fatigue and pain that tend to worsen after prolonged periods of inactivity, for example, in the morning as soon as you wake up, or following physical effort even of low intensity. Not only that, unlike what happens in healthy individuals, in people with fibromyalgia, the feeling of tiredness does not go away with rest and ends up interfering with daily activities. Although fatigue is a frequent disorder among fibromyalgia patients, it is not received as much medical attention as pain for a variety of reasons. Among these, we find the absence of guidelines capable of precisely evaluating the degree of fatigue and the lack of effective treatment strategies. Sleep disorders. In fibromyalgia, Sleep disorders are extremely widespread, so much so that over 75% of patients reported having experienced some form of it. Among the main mechanisms of action by which fibromyalgia negatively influences the quality and quantity of sleep, we certainly find musculoskeletal pain. While on the one hand, it makes it difficult to find a comfortable position to sleep due to the contact between the bed and painful body parts, on the other hand, it often interrupts the sleep cycle. This leads to frequent nocturnal awakenings, which prevent the body from recovering the energy expended during the day. In the morning, you will wake up more tired than the night before, resulting in excessive daytime sleepiness, which leads to memory and concentration problems, a decrease in school or work performance, as well as headaches and mood swings. When you wake up, you may also notice some muscle and joint stiffness with a decrease in strength in your hands and arms and a feeling of swelling in your hands and feet. Following some studies, it was also discovered that fibromyalgia can be associated with alterations in the levels of some neurotransmitters of the central nervous system, such as serotonin, norepinephrine, and dopamine. Among the numerous functions they perform, we also find that of regulating the sleep-wake rhythm, whereby a reduced activity of these chemical mediators determines poor sleep quality. Lower pain threshold. Pain is a physiological reaction, a sensory and emotional experience perceived at the central nervous system level in response to potential or actual tissue damage. In people suffering from fibromyalgia, pain can differ in terms of intensity and location between different patients, but it manifests itself with two precise characteristics: hyperalgesia and allodynia. Hyperalgesia indicates a pathological increase in pain sensitivity where there is an exaggerated response to a painful stimulus. It can affect certain skin areas or manifest itself in a generalized form. Allodynia, however, unlike hyperalgesia, indicates pain caused by a stimulus, which under normal conditions would be harmless and incapable of causing any type of painful sensation. Often just lightly touching the affected part is enough to feel discomfort. What we know is that the perception of pain is very subjective and can vary significantly from person to person, as it is influenced by a series of biological, psychological, social, and cultural factors, but above all, by previous traumatic experiences. In fibromyalgia subjects, there is an abnormal perception of pain and a reduced tolerance threshold for the same. Hyperalgesia and allodynia are therefore two characteristics that are frequently found in the symptomatology of fibromyalgia. In conclusion, if you notice one or more of the symptoms described in this video, it is recommended to always contact your doctor or a specialist, generally a rheumatologist. Fibromyalgia is a complex and widely underdiagnosed condition, so much so that on average it takes 5 years from the time a patient first reports symptoms to when they formally receive an accurate medical diagnosis. Targeted and timely treatment can significantly contribute to improving the management of symptoms and therefore the quality of life of the fibromyalgia patient.